Let us start with yellow fever. Yellow fever is a viral hemorrhagic fever caused by Viscerophilus tropicus, an enveloped single-stranded RNA arbovirus belonging to the flavivirus genus. It is, in fact, the original flavivirus in the Flaviviridae family, which also includes dengue virus, hepatitis C virus, West Nile virus, Japanese encephalitis virus, and the other encephalitidae viruses. Flaviviruses take their name specifically from the yellow fever virus, which is derived from the Latin word for yellow, flavus. Yellow fever has its evolutionary origins in Africa, where the virus made an interspecies jump from primates to humans. The virus and its mosquito vector were brought to the New World by the slave trade during the European colonization of the Americas. The first probable outbreak of the disease in the Western Hemisphere was recorded by Spanish colonists in 1648 in Yucatan, Mexico, where the disease was termed psiquic, or black vomit, by the Maya. Eventually, the disease spread to North America, with a number of epidemics occurring throughout the 19th century in New York, Philadelphia, and New Orleans, among others. Quote, Yellow Jack, as it was known in the United States at the time, is shown on the right as a sailor knocking at the gates of New York. After significant losses amongst U.S. forces from yellow fever during the Spanish-American War in the 1890s, U.S. Army doctors led by Walter Reed, shown here on the left, were the first to demonstrate that the disease can be transmitted by mosquitoes, a historic biomedical discovery after colleagues allowed themselves to be deliberately infected by vectors that had fed on patients with yellow fever. This disproved a long-held belief that yellow fever was transmitted by contaminated body fluids and excrement. As a result of disease control programs in many countries, yellow fever is now endemic only in parts of sub-Saharan Africa and South America. It is estimated that there are about 200,000 cases a year, resulting in more than 30,000 deaths annually. Yellow fever is transmitted by female mosquito vectors. In Africa, the Aedes species, particularly A. aegypti, or tiger mosquito, is involved, while in South America, the Haemagogus species is the dominant vector. Aside from human hosts, yellow fever also has a natural reservoir in primates. The symptoms of yellow fever manifest themselves after a short incubation period of 3 to 6 days and classically unfolds in 3 stages. The first stage, or period of infection, is one of severe, nonspecific signs of systemic illness, corresponding with viremia associated with fevers, malaise, headache, photophobia, nausea, vomiting, and myalgia, especially in the knees, for a period of days. Tender hepatomegaly may also be present, as well as Faget's sign, described as pulse temperature dissociation, whereby there is relative bradycardia despite high fevers. Moreover, the tongue may develop characteristic erythema along the tip and sides with a central white coating. The second stage, or period of remission, follows with clinical improvement. For the vast majority, or 85% of cases, the disease ends here. For the unlucky minority, or 15%, the respite ends after 48 hours. The final stage, or period of intoxication, is marked by the return of symptoms seen in the first stage, but further complicated by jaundice, hemorrhage, oliguria, and metabolic encephalopathy. One unique feature of yellow fever is a predominantly AST-elevated transaminitis as opposed to an ALT elevation typically seen with most viral hepatitis. Hemorrhage, as a result of thrombocytopenia, and inability to synthesize coagulation factors due to hepatic dysfunction. Mortality rates for those that enter this stage ranges between 20 to 50%. Yellow fever is diagnosed most commonly by serologic testing using ELISA to detect IgM antibodies against the virus. Additionally, Yellow fever can also be diagnosed using PCR to detect the presence of viral RNA in the stool and/or tissue. Treatment of yellow fever is unfortunately limited to supportive care, given that no known antivirals have been shown to be effective. Yellow fever can be effectively prevented by a live attenuated vaccine that offers protection for 10 years. It was developed in 1951 by Max Tyler of the Rockefeller Foundation, which earned him the first Nobel Prize ever awarded for the development of a viral vaccine. Mass vaccination programs against yellow fever have since been initiated by the WHO in endemic countries. In addition, it is recommended that all travelers to endemic regions be vaccinated prior to travel.